Hello everyone, welcome to Dentospedia, the most trusted platform specifically designed to help you excel in your dental board examination. So today I'm going to teach you a short topic which is non-restorative treatment, silver diamine fluoride from the module of pediatric dentistry. So let's begin with the topic. So see, non-restorative treatment, silver diamine fluoride. So silver diamine fluoride SDF is a liquid non-restorative agent used to arrest or stop the progression of dental caries and provide a preventive benefit with a simple, painless and clinical application. So see, mechanism of action of silver diamine fluoride. So see, SDF is effective because it combines the benefits of two powerful components, which is silver and fluoride. Understand? So see, silver acts as an antimicrobial agent. Understand? Silver acts as an antimicrobial agent that destroys the cariogenic bacteria, Streptococcus mutans, and Lactobacilli, which are responsible for decay. It can also inhibit the enzymes that break down the organic matrix of the tooth. Understand? So see, fluoride promotes the remineralization. Are you getting? Fluorides promotes remineralization. Understand? So it promotes remineralization of demineralized tooth structure. It reacts with the tooth mineral to form a hard acid resistant layer of calcium fluoride and phosphate on the surface. Understand? So it promotes remineralization as well as it promotes formation of calcium fluoride and silver phosphate on the surface of the lesion, making the arrested lesion stronger. Now, diamine acts as a stabilizing solvent to carry the silver and fluoride ions. Understand? So these are some of the mechanism of action of silver diamine fluoride. So see, it forms the silver phosphate crystal and fluorapatite which hardens the lesion surface. Understand? So you can see, but when it gets arrested, when the lesion get arrested, you can see in the image, it turns black. It gets discolored. The lesion gets discolored. Understand? So it is one of the disadvantage of SDF. Are you getting the point? So you can see the indication and application. Indication, contraindication and application. So see, SDF is a rapid brush-on application ideal for challenging patient population. So see, it is used in arresting cavities, used on cavitated carious lesion in primary teeth to stop the decay process, particularly when definitive restoration is not immediately possible. Understand? Used in children with multiple active decay lesion. Ideal for toddlers, very young, anxious or medically compromised patients who cannot tolerate the traditional restorative system. Understand? Now, it is suitable for lesions that are difficult to restore but easy to access for topical applications. Understand? So, these are used in non-cavitated, cavitated, high caries risk, medically compromised, and interim caries control. Now, it is contraindicated in silver allergy or ulcerative gingivitis. If the patient is allergic to, if the patient is allergic to silver, then you should never give SDF. In deep pulpal exposure, in aesthetic concern, why? Because the arrested lesion turns black. Understand? And if the parent is unwilling for tooth discoloration. Understand? So these are clinical steps. So first you have to isolate the area and you have to clean the cavity. First you have to isolate the tooth, clean the cavity and dry the surface. Understand? You have to dry the carious lesion. Then you have to apply a single drop of SDF. Understand? You have to apply a single drop. Is it equal to 5 teeth? You have to apply a single drop of SDF solution directly onto the lesion for about 1 minute. For about 1 minute with the help of a micro brush. Understand? Now remove the excess solution and allow the tooth to air dry or dry with a gentle air steam. Understand? Now you can see caries lesion turns black. It is indicative that the caries has been arrested. Understand? So you can see in the image SDF in the incisor after the arresting of the lesion, it has become black. You can see in the molar as well. It has turned black. Understand? So there are some of the precautions. You have to use petroleum jelly on lips to prevent staining. You have to avoid contact with clothing or skin because this can lead to allergy of silver. Understand? It can lead to silver allergy. You have to inform the parents about color change. Understand? See, SDF has revolutionized the management of caries in primary care. It is often used as a holding measure or interim treatment to stabilize active decay until the child is older. More cooperative or until a definitive treatment plan can be executed. Following application, the black stained arrested lesion can sometimes be covered with a glass ionomer cement or composite for aesthetic improvement. So this was SDF, Silver Diamine Fluoride. So for more detailed video, please download the app Dentospedia and please do like, share and subscribe our channel. Thank you very much.